Today, we're going to tackle one of the most important topics for families and individuals considering or currently receiving Spinraza treatment, the side effects. Spinraza, or nusinersen, is a groundbreaking treatment that has changed the lives of many people with SMA. But like all medications, it comes with potential side effects that it's important to understand. In this video, we'll go through frequently asked questions about Spinraza's side effects to give you a clear and balanced view. Before we jump into the side effects, a quick refresher on what Spinraza is. Spinraza is the first FDA-approved treatment for SMA and works by increasing the production of the SMN protein, which is essential for muscle function. It's administered via injection into the spinal fluid through a procedure called the lumbar puncture. Typically, patients receive 4 loading doses over 2 months, then maintenance doses every 4 months. The most common side effects reported by patients include headaches, back pain, respiratory infections like colds or pneumonia, constipation, nausea, fever, and vomiting. Headaches and back pain are often related to the lumbar puncture procedure itself rather than the medication. Many patients experience these shortly after the injection, but they usually resolve within a few days. Respiratory infections can happen because individuals with SMA often have compromised lung function, making them more prone to infections, rather than a direct side effect of Spinraza. Serious side effects are rare but can occur. These include bleeding or bruising, kidney problems, low platelet counts which can increase bleeding risk, and allergic reactions such as rash, swelling, or difficulty breathing. Doctors monitor patients closely with regular blood tests to detect any early signs of these issues. If you notice excessive bruising, blood in urine, or signs of an allergic reaction, seek medical attention immediately. Most side effects related to the lumbar puncture, like headaches and back pain, tend to last only a few days after the procedure. Other side effects like nausea or fever are usually mild and resolve within a week. Ongoing monitoring helps to catch any side effects early so adjustments can be made if necessary. Remember, many patients tolerate Spinraza very well with minimal side effects. So far, long-term studies suggest Spinraza is generally safe when administered properly. However, since it is a relatively new treatment, ongoing research is still monitoring for potential long-term effects. Kidney function is checked regularly because some animal studies showed potential kidney effects at very high doses, but this has not been a major concern in human patients so far. It's important to keep regular follow-up appointments to ensure overall health and treatment safety. For headaches after the lumbar puncture, patients can rest and avoid strenuous activity, drink plenty of fluids, especially water, use over-the-counter pain relievers like acetaminophen or ibuprofen, and lying flat for a few hours after the procedure can also help reduce headaches. For nausea and fever, managing hydration and nutrition is key. If side effects persist or worsen, contacting your healthcare provider is essential. No, not everyone experiences side effects. Many people tolerate Spinraza very well, especially as treatment progresses. Some may have mild side effects only with initial doses, and others may have none at all. Each individual's experience is unique, so keeping a symptom diary and communicating with your healthcare team is vital. Children and adults can experience similar side effects, but younger children might show signs differently. For example, infants might become irritable or have feeding difficulties when experiencing side effects. Parents and caregivers should watch closely and report any changes in behavior or health to the medical team. Since Spinraza is delivered through a lumbar puncture, the procedure itself carries some risks. These can include pain or discomfort at the injection site, headaches, infection, and bleeding. Healthcare providers follow strict protocols to minimize these risks, and side effects from the procedure usually improve within a few days. Compared to other SMA treatments like Zolgensma and Evrysdi, Spinraza's side effects are often related to the administration method. For example, Zolgensma is given as a one-time intravenous infusion and carries risks associated with gene therapy. Evrysdi is an oral medication and may cause gastrointestinal symptoms. Each treatment has its own risk and benefit profile, so discussing options with your healthcare provider is important. Always contact your healthcare provider if you experience severe or persistent headaches, signs of infection like fever or chills, excessive bleeding or bruising, difficulty breathing or swelling of the face and throat, or new or worsening symptoms that cause concern. Prompt medical advice helps ensure safety and allows for treatment adjustments if necessary. Spinraza has been a game changer for many with SMA, improving muscle function and quality of life. Like any treatment, it can come with side effects, but most are manageable and temporary. Understanding what to expect, how to handle side effects, and when to seek help empowers you to navigate your SMA journey confidently. Thank you for watching. If you found this video helpful, please give it a thumbs up, subscribe for more SMA awareness content, and share your questions or experiences about Spinraza side effects in the comments below. Your story can inspire and help others.